Okay, let's unpack this. Recovery after surgery, especially something as, well, significant as these vascular procedures in the legs and groin. It's it's not just about what happens in the operating room, is it?
No, absolutely not.
The time after is where the real healing roadmap kicks in, often with like incredibly specific instructions.
That's completely right. That post-operative phase, it's just crucial. It's where the body, integrates the surgical repair, where risks like clotting or wound issues need active management.
Right.
The instructions given are designed really precisely to protect that surgical investment and set you up for long-term success.
And today, we've got a really interesting set of sources from you, essentially a detailed discharge protocol, written by a specific doctor, Dr. Gregory Weir, for his patients after certain vascular surgeries. We're looking at things like femoral endarterectomy, Femoropopliteal thrombectomy, Iliofemoral thrombectomy, Iliofemoral bypass, and femoral bypass. Quite a list.
Yeah, these are procedures often done to restore blood flow to the leg, working on major arteries, usually around the hip, groin, or thigh area.
Okay.
And because of where they are and the nature of the work, the post-op care has to be very, very targeted to avoid stressing those areas.
So our mission for this deep dive, using the document you shared, is basically to go through the key instructions, the guidance Dr. Weir gives his patients. What are the critical do's and don'ts, the timelines, the red flags, all according to this specific protocol?
Exactly. We're analyzing this particular document's approach. It gives us a kind of window into the level of detail involved in these plans.
Now, right at the start, we absolutely have to highlight something that's explicitly stated in the sources, the legal disclaimer.
Yes, very important.
This is a discharge protocol Dr. Weir wrote specifically for his patients at his practice.
That is a vital distinction, yeah. This document is tailored to patients under his direct care based on his judgment, their specific surgery,
Exactly. So if you listening have had a similar procedure, but you're not Dr. Weir's patient, your doctor will have given you your own protocol. It'll be specific to your needs. What we're doing here is unpacking the content of this one document. Just understanding one example of a detailed post-surgical plan. We are absolutely not giving out general medical advice.
Definitely not.
Any questions about your own recovery, always discuss them with your own physician.
Think of it as understanding the careful thought process that goes into designing one of these post-op plans, using Dr. Weir's instructions as our guide today.
Okay, great. With that crucial point clear, let's dive into the core of it. Starting with that immediate post-op time, those first couple of weeks where the rules seem, well, particularly strict.
Right. This initial phase is all about protecting that surgical site, usually around the groin or upper thigh. And the most kind of striking instruction in the document, the one that really jumps out, is the absolute do not sit in an upright position.
Wow, that's quite a directive, not sitting up for 2 weeks. Why is that so non-negotiable?
Well, the key reason is really the biomechanics, the hip and groin. When you sit fully upright, like at 90 degrees, you create a really significant bend right where the surgery happened, where the artery was repaired or maybe a new bypass was connected. That bending puts direct stress, tension on the suture lines, on the vessel itself. It could potentially compromise the repair, maybe cause bleeding, or just disrupt the healing. Keeping the leg relatively straight minimizes that stress.
And the protocol allows just a tiny bit of leeway, a small exception.
Very limited, yeah. It allows for a 45-degree slouch. So think reclined about halfway back, not fully upright.
Okay.
But only for a max of 5 minutes at a time and only every 4 to 6 hours. It really hammers home how vital it is to avoid that full hip flexion.
So no eating at a regular table, no sitting in a standard chair for any real length of time. The document even mentions travel, no driving. And even as a passenger, keep the leg as straight as possible.
Absolutely. Any position, any activity that causes that significant groin bend needs to be avoided, especially in those critical first 2 weeks, just to let the surgical site start healing without disturbance.
Beyond just avoiding that bend, what other general restrictions are we looking at during this initial phase?
Strenuous physical activities are definitely out for the first 2 weeks. This isn't the time for anything that gets your heart rate way up or involves lifting heavy things.
Right.
Just letting the body rest and focus its energy on healing is really key.
And elevating the legs, that's mentioned too.
Yes, yeah. Elevating the legs above the level of the heart is recommended. It's simple gravity, really, helping to reduce swelling or edema,
Okay.
which is super common after these surgeries. Reducing that swelling can make you more comfortable and potentially help the healing process.
Hydration hydration also gets highlighted.
Yeah, good hydration, often overlooked, but it's very important. The document mentions it for reducing complications generally, but it specifically calls out its role in managing constipation. Because, reduced mobility, maybe pain medications, they can often lead to constipation. Staying well hydrated can help prevent that, or at least lessen it.
So those first 2 weeks are really defined by these strict positioning rules, limiting stress on the area, plus rest, elevation, and keeping hydrated. Okay, moving on, another critical piece is caring for the actual surgical wound. What does this protocol say about wound care?
The initial wound care instructions are also pretty stringent. No showering or bathing for the first 2 weeks.
Wow, 2 full weeks without a proper shower. That takes some discipline.
It certainly does.
Yeah.
A bird bath or sponge bath is allowed, but the absolute rule is keeping those wound sites dry.
Okay.
The protocol emphasizes keeping the wound closed and protected with a waterproof dressing.
And the source even gives an example, right? Mepilex Border AG.
Right. That type of dressing, a multi-layer waterproof one, is given as an example. The document then details how to manage it. Change the dressing every 3 to 5 days after cleaning the wound.
And specific cleaning solutions are listed too. Prontosan or sterile saline.
Yep. Using those sterile solutions is important. Minimizes infection risk right at the site. The protocol also gives clear guidance on what to do if the dressing gets saturated.
Saturated meaning?
Meaning you see fluid, like blood or maybe clearish, serious fluid, soaking through the dressing sooner than that 3-day mark. If that happens, you need to change the dressing immediately. And crucially, phone the consulting rooms.
Got it.
It's a sign that something might need medical attention.
That level of detail, down to product names and what saturated looks like, really shows how precise this post-op care needs to be. Okay, now, medications, obviously a huge part of recovery. What does this protocol say about managing meds?
Strict adherence. It's listed as essential. And for vascular procedures like these, preventing blood clots is, well, it's a top priority. Got to keep the blood flowing through that repaired or bypassed vessel.
And it mentions common drug combinations for that.
Yes. It notes that an antiplatelet drug, something that helps stop platelets clumping together to form clots, like aspirin, is often combined with clopidogrel, which is another antiplatelet. The combination gives stronger protection against clots forming. It also clarifies that if a patient was already on a stronger anticoagulant, what people often call a blood thinner, like warfarin or rivaroxaban, before the surgery, they typically keep taking it afterwards, too.
What about medications for other health conditions, like blood pressure or diabetes?
The protocol explicitly says patients should continue taking their regular meds for chronic conditions, high blood pressure, diabetes, high cholesterol, all of that. Managing those underlying issues is critical for overall health and, frankly, for preventing future vascular problems, too.
We touched on constipation earlier, and it pops up again here in the medication section.
Yes, because it's such a common post-op issue, right? Pain meds, less activity. The document notes that Movicol, a laxative, can be used if needed, and again, stresses hydration.
Right.
And it advises contacting the rooms if you experience severe constipation. Don't just suffer through it.
It's really clear there's a strong emphasis on communication if any issues pop up. Which brings us neatly to monitoring and follow-up, knowing when and how to get help.
This is maybe the most important section, safety-wise. The protocol tells patients to contact the consulting rooms if they have any problems with their legs, their wounds, or, importantly, any other sudden changes.
And it gives specific examples of urgent signs, things that mean call immediately.
Exactly. It lists sudden onset of pain, swelling, loss of sensation, weakness, discoloration, bleeding, or any other sudden change in the leg. These need immediate contact.
Why those specifically?
They could indicate serious problems like a new blockage, maybe an issue with the bypass itself, or significant bleeding, things you don't want to wait on.
And the general principle seems to be, don't wait and wonder.
It's very clear. When in doubt, phone the consulting rooms. That's highlighted as the main rule. It's always better to make the call, get reassurance or advice, than to sit at home worrying if a symptom is serious.
And there's a built-in check-in schedule too, isn't there?
Yes, a mandatory follow-up appointment is required. It needs to happen at the consulting rooms within 2 weeks after the procedure. That lets Dr. Weir assess the surgical site, check on how recovery is going overall, and guide the patient into the next phase of their care.
Speaking of the next phase, what does this protocol outline for the longer term, beyond those initial really strict weeks?
Right, so once that initial sort of delicate healing period is over, the focus shifts. It moves towards rebuilding strength and maintaining long-term vascular health. The document notes a full exercise program can typically restart after about 6 weeks.
But there's encouragement for activity before that 6-week mark.
Absolutely. Patients are encouraged to gradually increase their daily activities as they feel able. And crucially, the protocol stresses the importance of daily exercise in the long term. It specifically recommends things like walking, cycling, and swimming.
These are all great cardio activities, obviously.
Yeah.
But is there a specific reason to call out walking, cycling, swimming after leg vascular surgery?
Yeah, there is. These activities are excellent for strengthening the calf muscles. You sometimes hear the calf muscles called the body's second heart.
Oh, interesting.
Because when they contract, they play a really vital role in pumping deoxygenated blood back up from the legs towards the actual heart. So strengthening them improves overall circulation in the legs, which is particularly important after you've had surgery aimed at improving arterial blood flow down to the legs. Good muscle function just helps the whole system work better.
That makes perfect sense. The protocol also lists long-term weight control as essential.
Weight management has a huge impact on overall cardiovascular health. Carrying excess weight puts extra strain on the vascular system, and it can contribute to the very conditions that led to needing surgery in the first place.
Right.
So maintaining a healthy weight is a key strategy for preventing future vascular issues.
And finally, number 3 on the long-term list. Smoking cessation. Essential.
Undeniably essential, yeah. Smoking is just one of the most significant risk factors there is for vascular disease. It damages blood vessels, promotes plaque buildup, it directly threatens the success of the surgery, and massively increases the risk of blockages elsewhere.
And the protocol doesn't just say quit, does it?
No, it goes further. It mandates cessation, but it even mentions potential aids, things like varenicline or bupropion if patients are struggling to quit on their own. It encourages them to seek help from the consulting rooms if the usual measures aren't working.
Wow. So looking back at this whole protocol you shared, it really is a comprehensive roadmap, isn't it?
It really is.
It takes the patient from that immediate, highly restrictive period focused on protecting the surgical site through detailed instructions on wound care, medication management, clear guidance on when to get help, and then smoothly transitions into those long-term lifestyle changes needed for sustained health. Daily exercise, weight management, and definitely stopping smoking.
It lays out a really phased approach. It recognizes that recovery isn't just one straight line, and you need different focuses at different times. And the level of detail provided from specific positions, naming products, defining urgent symptoms, it really underscores the precision needed in post-op care for these complex procedures.
And analyzing this specific document like we have today, it really highlights the partnership involved in recovery, doesn't it?
Yeah.
It's not just the surgeon's skill in the OR. The patient's diligent adherence to these detailed instructions is absolutely fundamental.
Exactly. And understanding why these rules are in place. You know, why not sitting upright protects the repair, why leg elevation helps with swelling, why strengthening those calf muscles improves circulation. That understanding can truly empower a patient. It turns a list of seemingly arbitrary rules into like a strategic plan for healing that you, the patient, are actively participating in.
It really makes you think, doesn't it? How much of successful medical outcomes rely not just on the procedure itself, but on that patient's journey afterwards, guided by these incredibly specific, personalized protocols. It's a powerful reminder that the minor details in these instructions often have a major impact on healing and, long-term well-being.